Hi, I'm Dr. Janet Pope at Room Now. I'd like to give a bit of a roundup. And my first theme is really learning from a large database. And this is going to be lifestyle behaviors prior to the onset of disease. So there were two large studies of the Nurses' Health Study. And the Nurses' Health Study actually has two very large cohorts. And it really is an incident cohort study because people don't have a particular disease of interest and then going forward. And the question in both these studies, well, in the study of Nurses Health Study, the two abstracts were what about modifiable risks for obtaining diseases such as rheumatoid arthritis or lupus in the future? And the first abstract was for rheumatoid arthritis, abstract number 1198, and they looked at a validated cardiovascular risk of modifiable risk factors. So they looked at diet in better diet in the upper 40%, exercise that was somewhat aggressive each week, some degree of alcohol drinking, no smoking ever, and having a normal BMI. And what they found was in a sort of dose response, if you had none of these modifiable things in favor, you had more rheumatoid arthritis than if you had, say, two, three, or four of the or five of the modifiable risk factors. And basically, one third of rheumatoid arthritis in the Nurses' Health Study could be explained by uh, not having these healthy living variables. Then they also looked at SLE, so May Choi and others from Harvard looked at the same idea in lupus, and they actually found up to 50% of modifiable risk factors could explain getting lupus. That was abstract number 1473. So, what we don't know in any large database like this is what about major life events? What about stress? What about infections prior? Also, we know that lifestyle features are interrelated. This group has already shown that high BMI or high BMI and smoking give more ACPA RA, as a for instance. The other limitations are what about the generalizability? These were all nurses, they're completing their forms, so education is higher. These were all nurses who were women for the study, so we don't know about the generalizability to men. And the elephant in the room, I think, is also what about poverty? We can't address the higher impact that maybe poverty would have on people with overcrowding, more infections, worse lifestyles, health related behaviors that maybe are less modifiable. However, overall, I think that in general, living a healthy lifestyle makes a lot of sense. And in particular, for our at risk patients, such as first degree relatives, when they say, my relative has RA or lupus, what should I do? I think we have a good recipe to give them. Hard to follow the recipe, but it's a great one. Thanks. Follow us at Room Now.